Welcome to PACU Nursing Minutes, where we are going to talk about phase 1 recovery in PACU. So, PACU phase 1. This is the very immediate post-op phase when the patient comes out of the operating room. And there are guidelines around this phase. They are recommended by the American Association of Perianesthesia Nursing, which is ASPAN. And this level of care is called level 1. And there can be 3 different ratios for nurses to patients during this phase. And it really just varies on every single patient. Some people come out of the OR very stable, some come out of the OR unstable, and there are short periods of time where there may need to be more hands on the deck. So we're going to talk about these 3 different scenarios where you can have 1 nurse to 1 patient, you can have 2 nurses to 1 patient, or you can have 1 nurse caring for 2 patients. So here we go. So class 1-to-1, 1 nurse, 1 patient. This is the most common scenario that you will find in the recovery room. And it's the initial arrival from the OR to the PACU. And it is from the period of time until arrival till critical elements are completely met. And I will go over what those critical elements need to be to have been met before that nurse can take a second patient. Always airway and hemodynamic stability need to be maintained. If any of those 2 are unstable, you are continuing to care for that patient until you get stability. Any child under the age of 8 who is unconscious is always a 1-to-1 nurse-patient ratio. And then there always needs to be a second nurse available to that first nurse to assist with recovery. So 1 nurse to 1 patient ratio. This is how a lot of our patients may look when they arrive out of the OR. They come out of anesthesia and they're in a deep sedation level. And you can obviously see right here that we have an oral airway in place and to maintain an open and patent airway. This is a 1-to-1 patient ratio. You are not allowed to leave the bedside when there's an oral airway in. So this is one of the most classic scenarios that you will find in PACU. And they may need that oral airway for just like 30 seconds, or they may need it. I had 1 patient once for like almost 40 minutes. So it just really depends on how deep they are in anesthesia when they come out of the OR. So more about this phase 1, 1-to-1 ratio. So those critical elements that ASPAN talks about. You need to have received report from the OR nurse. You need to have received report from your anesthesiologist. Then the patient's airway is the first thing you always assess. And actually you're looking at that airway when they roll out the OR and they're coming down the hall to you. And it needs to be open. It needs to be patent. They're ventilating and stable. Your initial assessment, head to toe, that surgical site needs to have been looked at and assessed and intervened if an intervention needs to be done right away. They need to have hemodynamic stability. They need to have a stable heart rate, not too bradycardic, not too tachycardic, not hypotensive, at least a MAP above 60. So they need to be free from agitation. When people emerge from anesthesia, which we'll talk about emergence, they go through these levels, and delirium emergence is one of those phases. And so our patients are either totally obtunded and in deep sedation, or they can wake up like this lady, just totally confused and not knowing where they are. And they usually just need some time to clear their mentation and to get reoriented. And so during these phases, we need to maintain their safety. And so they are a 1-to-1 at this time. These are the critical elements. So phase 1 level of care where you can have 2 nurses on 1 patient is usually your ICU patients, that trauma that comes in, or somebody who needs to have manual jaw thrust done. I've had to do that multiple times. And in that scenario, you are just, 1 nurse's job is just holding that airway open. Sometimes the oral airway isn't long enough and you need to do a manual jaw thrust. So if that's the case, then you need to have a second nurse who's there doing the charting, or one of you needs to take over the airway, because that's the only thing that you should be doing at that time. If there's any evidence of obstruction, you need to be repositioning the patient. If there's any evidence of hypoventilation, distress, you need to intervene, BMV, bag mask valve, ventilate your patient, having conversations with anesthesia. So this is when it's critical, and they are not a one-to-one scenario. There are two nurses to one patient, maintaining that safety. So, and then the next scenario that we can have in phase 2, which is, I would say, one of the other common scenarios, is where you have one conscious, alert, stable patient, and then you receive a second patient who is stable. They may be conscious or unconscious, but they are hemodynamically stable. They don't have any complications. And then you can have two conscious patients who are waiting to leave the PACU. Like, that's a classic scenario with our orthopedic patients, like two people who have had a spinal, maybe a knee replacement and a hip replacement patient. And they are just waiting to go to their rooms. And then two pediatric patients with parents present who are alert and stable. Most places where I've worked out, we keep our pediatrics 1-to-1 in phase 1. Two conscious peds with parents present, you will find that more in phase 2. So every hospital is different. So I would say get to know what your hospital does, what your standard of practice is, and know those critical elements, and know that those are 1-to-1 scenarios. So references, this came right out of the perianesthesia core curriculum, and so I recommend that you refer there. ASPAN also has their recommendation guidelines for standards of practice there as well. And the pictures that I use in most of my PACU Nursing Minutes videos will be from megapixels. They've got great reference, so go ahead and check them out. And then again, always follow your institutional's policy and procedures, follow your physician's orders and your nurse practice acts. And I definitely would recommend that you check out your nurse practice acts, especially for talking about phase 1. We haven't gotten into the conversation about extubating patients. I know in the state that I practice, it is not within my scope of practice to extubate a patient. So get to know your nurse practice acts so that you can maintain your safe practice. And again, PACU Nursing Minutes is free of any legal liability. And thank you so much for tuning in to our phase 1. Please like and subscribe to PACU Nursing Minutes and ring the bell. Thank you, Nurse Kathy.